No? Okay. All right, here we go. I'm going to explain each one. The medical management for individual, the differences in shock, that's what you're going to have to know, right? So what's the definition of shock? Shock.
The mean arterial pressure
Of?
under 60.
Right, so it's a mean arterial pressure of less than or equal to 60 millimeters of mercury. And how you calculate mean arterial blood pressure is 2 times the diastolic blood pressure plus the systolic blood pressure divided by 3. So if it's less than 60, then you cannot perfuse your brain and vital organs, and by definition, you are in shock. All right? So the different types of shock, and I'll go through each one. You have, and I'll give you a quick overview. Number one, cardiogenic. Cardiogenic. And cardiogenic shock is where the heart fails as a pump. Right? Heart, genic, originating. Now, the heart fails as a pump. So this is not a volume problem, right? So the last real thing you want to do in someone who's in cardiogenic shock is give them volemia. Too much volemia can cause cardiogenic shock. So all you need to understand in cardiogenic shock is the heart is failing as a pump. So you want that heart to pump better. Say yeah. Okay? All right. Number 2 is distributive shock. And this is also called a high output shock. Basically what's happening here is the systemic arteries are massively dilating, right? So the heart's not failing as a pump. What distributive shock is an arterial resistance problem. Yeah. And distributive shock comes in several flavors. Number 1 is neurogenic shock. More about that later. Then you have my favorite, anaphylactic shock. And then you have septic shock. These are all forms of distributive shock. All right? And then you got number 3, which is hypovolemic shock. So in this case, they may or may not be bleeding, but they're losing blood volume. And one of the things that happens in people who have really bad burns over a large area of their body, the reason they die within the first 24 to 48 hours is due to hypovolemic shock. So you got to give them volemia. Okay. And then the final type of shock is, I can never spell it, so you're going to have to spell it. Bleeding a lot shock. That's hemorrhagic shock. Can you spell, anyone spell hemorrhagic? Ilda, can you spell hemorrhagic? No? Okay, then don't hate. Can Can you spell hemorrhagic, Emily?
Does it have two M's?
I don't know. Okay. Well, if you can spell hemorrhagic, if you put that on your quiz and you spell it correctly, I will give you extra credit. Isn't that nice, Shirley? See how nice I am? Okay, so what I want to do is first I want to go over the distributive shocks, okay? Especially now, this is a good time of year for distributive shock. Would you agree with that? All right, so the first thing I want to do is I'm going to go over anaphylactic, septic, and neurogenic. Neurogenic is actually kind of a, if shock is cool, kind of a cool shock. All right? So, first of all, we got to do a couple of things. Number one, almost all allergies are related to antibodies. And we know that antibodies are produced by B cells, right? B lymphocytes. We know this, right? And over time, what happens is when you're exposed to something, a B cell will become sensitized to it, and it will produce an antibody that is specific for that antigen. So the goal of being exposed to stuff is just that. You build your immunity. How many people here have a little kid or had a little kid, right? So you had a baby, and then before the baby came home, the guys in the white suits, and they sterilized your entire house, right? So the kid never got sick. Then you take him to booger-infested daycare, right? Where you can't swing a dead booger without hitting kids with boogers all over them, right? So, and that kid is sick 6 months out of the year. And the reason that kid is sick is because they are building their immune system. Are you following this? Now this is important. I'm going to simplify this. Watch. What's this? Sarah, how did you know that? And watch. Embedded in a B cell are these little protein receptors, and these are actually, the receptors are actually antibodies. These antibodies are actually, they're proteins. You got me? And know this, that floating around in your blood and lymphatic system and in your lymph nodes, you have millions and millions of different types of B cells, and each one has a specific receptor that is going to bind a specific antigen. Are you with me? So if you got this thing, who cares what it is? This is some type of foreign thing. It looks like a little ball. This is an antigen. So an antigen is anything that's going to produce an immune response. So one of the first things that happens when you're exposed to an antigen is a specific B cell is going to come in contact with it. Are you with me? This is the important piece. And have you ever gone to a party with a bunch of people and you only know one person? So you grab as many drinks as you can hold, and then you run through all the waves of people trying to find that one person that you know, right? Then you sit there and talk to them, and then you just drink, and you get all liquored up. How many people got liquored up this weekend? Anybody? Nobody? Bill, did you get liquored up? Did you? Yeah, girl. You're getting extra credit. Right? Okay. Now watch. When a specific B cell comes in contact with an antigen, it gets turned on. And sometimes it doesn't call you back. I hate me too. Now watch. So what it will do is this B cell is going to come in contact with the antigen. And how it comes in contact is by this specific receptor binding to it. Are you with me? Guys? And when it does that, it gets turned on, and that B cell divides. Who remembers this? What does it divide into? And? Nice. That's incredible. Ethan. It divides into memory B cells, and it divides into plasma B cells. And the reason I'm going over this is because you need to understand this. And the plasma B cells then begin the production of antibodies. And it is, in fact, the antibodies that attack and destroy the specific antigen. And it is specific. It is like the Terminator and Sarah Connor, right? All he wanted to do was kill Sarah Connor. People got in his way, so he had to kill them. But he was programmed to kill Sarah Connor. Now, you better write this down. On your first exposure to an antigen, the plasma B cells do not make a lot of antibodies. Do you understand this? So, if let's say, for example, this little antigen was the flu. If you have never been exposed to that strain of the flu, then you don't have a B cell that has been programmed already. So you have to program a specific B cell. But the process of memory cells to plasma cells and then making antibodies takes time. And in that time, that virus infects you and you get sick. But now, what do you have lying in wait? Memory cells. You better write this down. So, on your second I'm writing this down. On your second exposure to the same antigen, what do you have lying in wait? You got memory cells. And those memory cells So when you come in contact with that same antigen, these memory cells, they don't produce one plasma cell, they produce hundreds of thousands of plasma cells. And instead of it taking days or weeks to produce those thousands and thousands of plasma cells, it takes hours or days. And those memory cells will create thousands of plasma cells. And what do plasma cells produce? Those produce antibodies. So those thousands of plasma cells will produce gazillion specific antibodies. And those specific antibodies are made not in days or weeks, but in hours. And those gazillion antibodies will attack and destroy this antigen before it can infect you. Do you follow this? Say yeah. How many people are with me? Okay. Now, watch. Write this down. First of all, what's the function of the immune system? It is to produce inflammation, but its job is to protect you. And it protects you by producing inflammation. So inflammation is a good thing. Say yeah. You got me? All right. What does this mean? PHY. Right. What is this? What's anaphylaxis? That means is a total body allergic reaction. That's anaphylaxis. So anaphylaxis and allergies in general are one time the body does stuff that doesn't make sense. They're overreacting to something that they shouldn't overreact to. Who's with me? All right? So, and to get an anaphylactic reaction or a total body allergic reaction, whatever you are allergic to, you have to ingest or inject into you. So it has to circulate throughout the entire body. That's what produces an anaphylactic reaction. So you should not get an anaphylactic reaction by touching poison ivy because you're not injecting it or ingesting it. But if you're allergic to peanuts and you eat some peanuts, you've now ingested that, and that allergen that's in those peanuts will get absorbed into the bloodstream and circulate all over your body. Say yes. All right. So with that in mind, I got to do this. Oh man, that means he can't go golfing. I know. There's my Kahoot stuff. I'm going to send that to Sarah. I am. Okay, wait. Okay. Now, you learned this in anatomy and physiology. So I'm going to go over this very, very quickly. Ashley, do you remember this? Ready? Okay. Write this down. You can write this down. Located in all the tissues of your body. All the tissues of your body. All of them. Where? 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 All of them. Okay? You have these things called mast cells. Did you ever hear of mast cells? Did you? Sweet. And mast cells contain a chemical called histamine. When mast cells release histamine, histamine does two huge things. It causes massive arterial vasodilation and increased capillary permeability. I like saying that because it makes me feel good. Increased capillary permeability means the capillaries get leaky. You got me? Watch, you learn this in A&P, never forget it. There are three places that fluid is located in your body. In the blood, in the interstitial space, and in the cells. Say yeah. If it ain't in the cell, it's called extracellular fluid. Are you going to write that down? Okay, good. Watch. Only the fluid that's in the blood makes up blood fluid. If it ain't in the blood or comes out of the blood, what's going to happen to your blood volume? If fluid that was in the blood comes out of the bloodstream, the cardiovascular system, what's going to happen to your blood volume? It's going to go down. Very good. Say yes. Are you with me? All right. So what do histamines do? They cause massive arterial vasodilation and they increase capillary permeability. Are you with me? So we should try this. Let's try it. Each one of you come up individually and just put your hand here. And then I'm going to smash it. So watch. Anytime you damage tissue, you rupture mast cells. What do mast cells contain? Histamine. So when the mast cells are ruptured, it's going to release histamine. Say yes. What do histamines do? They cause massive arterial vasodilation. Arterial vasodilation. And what kind of blood is carried by arteries? Blood that is, and it's red and it's hot. It's warm. So what happens? Emily, let's try it. When you injure damaged tissue, you rupture mast cells, you release histamine, and that causes the arteries that supply that damaged area to dilate. So arterial blood is going to go to that area and it's going to become red and warm. Say yes. And what else does it do? It causes increased capillary leakiness, permeability. So fluid that was in the bloodstream now leaks into the interstitial space, so that area becomes swollen. All right, here we go. I'm sure you guys all did this when you were younger. Batting stances. Who is this? Kevin, who is this? Cat Burke. Played for the Cubs in the 70s. Utility infielder. I'm surprised you didn't get that.
Is swollen the same as inflammation?
Swollen is a way of describing inflammation. The process of inflammation is what I'm explaining to you. The increased capillary permeability causes fluid from the bloodstream to leak into the interstitial space, and that causes the edema, the swollenness. Tell me you got that. Guys? Who's with me? All right. Now, since we're on this, I just want to show you something else. Because all of this stuff, you need to understand this if you're going to understand anaphylactic shock and septic shock. Do you understand this? Now watch. Let's say that somebody didn't like you. And again, that's hard to believe. And they took a broom handle and they stabbed it into you. See that? What the hell happened there? You got me? Now watch. These little green things that look like Tic Tacs are bacteria. Are you following me? Right? So if you get a splinter or you get a cut, that area becomes red and warm, right? That's because anytime you damage tissue, what do you rupture? Mast cells, and mast cells will release histamine and cause the arterial vasodilation and the increased capillary permeability. Now listen up, because this is true. The reason bites and puncture wounds are so effective is because they don't bleed. Bleeding your own blood is good for you. Let's try it. When you bleed, that blood will actually wash out bacteria to prevent the infection. Puncture wounds don't bleed. That's why they're infective. Tell me you got that. You step on a rusty nail, get lockjaw. Did Jeremiah ever say that to you? Kev, did Jeremiah ever say that to you?
No, but I did step on a nail.
And you got lockjaw?
And I thought I went to see the doctor. And the doctor said, if it hurts, don't walk on it. And I had just like taken a bus, like an hour and a half bus ride. Like, you couldn't tell me that.
Well, you wouldn't have gotten. He wouldn't have gotten paid, Kev. Did he give you a tetanus shot?
I think I had.
Oh, okay. Good. How many people are following this right now? Now watch. Watch. Just watch this. This is actually a really good video. And only 157,060 people have watched it. And I've watched it 157,000 times. All right? Watch. When you damage tissue, you're going to get that histamine release. Please get this right. Where are white blood cells? In the blood. Where do you want white blood cells to go when you damage tissue and you have an infection? Into the damaged tissue, right? So the histamines cause the arteries that are supplying that area to dilate, and where does arterial blood always go? The path of least resistance. So where are the vast majority of white blood cells going to go? Are you with me? The capillary permeability as a result of the histamines, we're going to skip ahead a little bit in the interest of time and less pain for you. The histamines are going to be released, cause the arteries to dilate, and then cause the capillaries to get leaky. That little leakiness of the capillaries allows the white blood cells to migrate out of there through a process of diapedesis. Oh! This is the important piece. When a white blood cell comes in contact, sum it up. When a white blood cell comes in contact with an antigen or pathogen, it releases chemicals. You got me? Write this down because it's going to help you. When white blood cells come in contact with an antigen or pathogen, they release chemicals. Those chemicals, sum it up. Those chemicals that white blood cells release include chemicals called prostaglandins, tissue necrosis factor, TNF, heparin. What is heparin? What is it? Right, it prevents the blood from clotting. You got me? And you don't want the blood to clot because if the blood clots, then white blood cells ain't going to get to that area. Tell me you got that. That's why when you twist your ankle and it starts bleeding, you end up with a big bruise because you don't want the blood to clot right away. The other thing that they release are these things called bradykinins. And the other thing that they release are thromboxane. All right? Now listen to this. All right? This will prevent the formation of a blood clot outside of a vessel. And you don't want that to happen right away because you want that blood to be thin in order for the white blood cells to get to that area. Are you with me? The other thing that prostaglandins and bradykinins do and tissue necrosis factor do is they increase capillary permeability and also cause vasodilation. So these things, these chemicals that are released from white blood cells, amplify the effects of histamine. They are pro-inflammatory agents. They make the process of inflammation worse and happen longer. Watch. How many people have ever got a sliver and it got infected? Nobody? You guys have lived a charmed life. Well, if you did, it's painful. And the reason it's painful is because prostaglandins stimulate pain receptors in the area. Tell me you're with me, guys. And you're not going to believe this, but there's a drug out there that inhibits the synthesis of prostaglandins. Do you know what that drug is called?
Isn't it pretty common?
Wait. That's a hangman. You clearly do not know how to play this game, huh? It's ibuprofen. Did I spell it right? It's ibuprofen. Listen up. Ibuprofen prevents white blood cells from manufacturing prostaglandins. What stimulates pain receptors in a damaged area? Prostaglandins. That's why ibuprofen can be used as an analgesic. What stimulates the inflammatory process? Look, watch it. Watch it. Prostaglandins. That's why ibuprofen can be used as an anti-inflammatory. You're not going to believe this. Guess what stimulates thermoregulatory receptors in the hypothalamus and causes a fever? Wait, don't say it. Okay, now say it. Say it. So when prostaglandins go up, you get a fever. That's why ibuprofen can be used as an analgesic, an anti-inflammatory, and an antipyretic, because prostaglandins do all three things. You know who will explain that to you? How many people have had pharmacology? Right. Did they explain that to you? Right. They didn't. Watch. If your kid's got a fever, or maybe you do. Amanda, you got a fever? You're looking warm over there. What did they tell you to do with your kid? Tylenol and ibuprofen. And the reason they tell you to do that is why? Sarah? Do you know why they tell you to do that? Because that's what you're told to say. Tylenol prevents the synthesis of prostaglandins in your brain. Where do you feel pain? Where do you get a fever? That's why Tylenol cannot be used as an anti-inflammatory, because it works centrally. Doesn't work peripherally. And because the mechanism of action is different, you can alternate the two. No one will explain that to you. How many people have had pharmacology? Right? They never explained that to you, did they? Do you realize how good that?
I remember
What's that?
I don't even know what I learned in pharmacology.
I feel like I just know don't take over 600 milligrams or something.
I feel like I memorized so much stuff just because that's
I just learned her stories. How they gave me access to the job.
just flashcards.
Black box
all
warnings.
everything. Yeah.
Black box warnings. Patient education. Patient education. Flashcards.
They didn't tell you how these drugs worked?
There's
Huh?
like a little like in a chapter, there'd be a little section for drug. Just keep it moving. Next one, keep it moving. You get this one.
Know what to take with it, when to take it.
The main thing about it, the main thing. Like vancomycin, remember this one thing.
Yeah,
And that's it.
yeah.
Okay?
Causes renal failure. Yeah.
Got it?
Watch. Now you understand why they do that. Say yeah.
Is ibuprofen stronger or better at inhibiting the prostaglandins
Then,
than Tylenol?
not centrally. Tylenol's better.
I just feel like whenever my kids have a fever,
Tylenol's better?
no.
Ibuprofen's better?
Ibuprofen always takes it down.
I really don't know. I really don't know. But the reason they tell you to alternate it is that you don't develop toxic levels. Even though both of them are metabolized in the liver, the way they're metabolized is slightly different. So you don't want to overwhelm those enzymes in the liver that detoxify that stuff. So yeah, that's why you alternate it. Did you follow this at all? Guys, yeah?
So TNF, are those markers, or is that actually necrotize?
Yes. 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 One of the things it will do is that any surrounding tissue that's bad, that tissue necrosis factor will kind of attack and destroy those cells. Any potential damaged cells, it kind of attacks it and marks it for death, kind of. So, like, it's like a condemned sign on a house. Or, you know. Guys, did you follow this at all?
So those all come out of a white blood cell.
All of those are produced by white blood cells, right? So watch. When you have bacteria in your blood, all of this stuff that's supposed to happen outside of your bloodstream happens inside your bloodstream. That's very important that you understand that. Okay, when we get to septic shock, are you with me? All right? The reason I went over the process of inflammation is septic shock and anaphylactic shock are closely related, right? It deals with a kind of a jacked up immune response. All right? So here we go. Watch. And look, no one can argue with this. No one can argue with this. Is that if you understand the basic pathophysiology, you will know what to do for these people. Yeah? Okay. So, watch. I gave you a kind of a 2-second overview of the immune system, B cells being sensitized and then producing these plasma cells. And when you come in contact with that antigen again, you get this massive antibody response. Say yes. Okay. This is how an allergy develops. Ready? The same thing happens. In this case, this antigen is something you're allergic to. So it's an allergen. You're following me? Now watch. What do you got floating around? You got B cells. How many different types of B cells you got? Gazillions of them. And each B cell type has a specific receptor on it called, that's a terrible receptor. It's supposed to fit better. Got a little muffin top there. That looks like a flower. Ah. Don't it?
You say that things that end in GEN are neutral?
Yeah, well, not all of them. Just like not all enzymes end in ACE. Yeah. Right? Trypsin. So there. Right, Kelly? Yeah. If you were nice, you can add that neuron right there. Just take it. Just hide it when you leave. Guys, watch. So you got this allergen. It's going to bind to a B cell. You with me? This is important. And on the first exposure, is that antibody response going to be huge? No. So these plasma cells that are produced are only going to produce a small amount of antibodies. But this is the kicker. You better write this down. Better not pout. The antibodies that the plasma cells produce, this is the additional step that occurs. So these are the antibodies that are produced by these plasma cells, and they're specific. These antibodies bind themselves to mast cells. What do mast cells contain? Histamine. So when the allergen is bound to the antibodies that are now bound to the mast cell. So when the allergen binds to the antibodies that are attached to these mast cells, the mast cells release histamine. What do histamines do? And they cause, what do they do to the arteries? They cause massive arterial vasodilation and increased capillary leakiness. Say yes. Anybody here got hay fever? You allergic to hay? Pollen? Where does the pollen enter? Your nose and your eyes. You got me? So when you have an allergy to pollen, nose, eyes, what happens to your nose? It starts running because the capillaries become leaky. So what's leaking out of your nose is blood plasma. That's why it tastes salty. You ever lick your watery boogers? Right, that's plasma, right? And what does your nose become besides get runny? It gets what? It gets stuffy because the blood vessels are dilating. Say yeah. So what do they do for people who got hay fever? They give them antihistamines, right? You better write this down. Are you going to write this down? Who's writing it down? Antihistamines prevent mast cells from releasing more histamines. They stabilize the mast cell and prevent it from releasing more histamines. I'm going to say this very slow so you can write it down in big letters. Vanessa, are you going to write it down in big letters? Antihistamines don't do anything for the histamines that were already released. And what did the histamines that were already released do? What do you mean, no idea? I'm
They produce the sperm.
What?
And then we
No, I was squaring it off and I'm writing it again.
No, that's why he just kept going. I'm just like, no idea.
They cause massive arterial vasodilation. What is the only thing that you know that causes massive arterial vasoconstriction? Epinephrine. So, do you think that it's overkill to give someone who's got a stuffy nose epinephrine? I need a shot of epinephrine, my nose is stuffy. Do you think that's excessive? Do you? I don't think so either. Bunch of haters. So instead, watch. You go to the drugstore and you say, I want something that resembles epinephrine to constrict my blood vessels. and they give you pseudoephedrine, Sudafed, fake epinephrine. And what does Sudafed do to all of the blood vessels in your nose and in your eyes? It constricts them. Say yes. Does pseudoephedrine know to constrict just the blood vessels in your nose and in your eyelids? It constricts your blood vessels where? Everywhere. That's why it says on the side of the box, if you have high blood pressure, talk to your doctor before taking Sudafed. You ever take Sudafed? Right? How you feel? Like a dumbass. Look how stupid I am. I had sinus problems really bad, so I go and get some Sudafed, and I'm like, I think it's pretty bad. So instead of taking 2, I took 6 at 9 o'clock at night. So at 3 o'clock in the morning, this is no joke, I'm sitting on my bedroom floor, rocking back and forth like this, and my heart is racing. Go figure. Tell me you got that. That's why patient education with allergy drugs, you take your antihistamine at night and your Sudafed in the morning. Watch. Benadryl crosses the blood-brain barrier and produces a sedating effect. Claritin doesn't cross the blood-brain barrier as much. That's why it has a less drowsy effect. No one will explain that one to you either. Ain't that right? So the D in Claritin D is pseudoephedrine. That's why you got a sign for it, because people make meth out of it. I bet you some people in here do it. You ever see somebody who smokes, do you smoke meth or snort it?
Both.
Can you?
How do you feel about it?
Oh, really?
What is it?
Do you know why they got bad teeth? What's that? No, they're too busy making meth and they ain't got time to brush their teeth. When they smoke it or snort it, it gets on their gums and causes the blood vessels to constrict in their gums, and they cut off the blood supply to their teeth. That's why their teeth run out. The education continues. Tell me you got that. Ready? How many people followed this?
What is it that could possibly kill anaphylactic shock? Like the EpiPen would save you?
Yeah.
What is that? Did you hold that yet? Or is
No.
How is that?
I haven't gone over anaphylaxis yet. Alright? So, watch. How do you get anaphylactic shock? A total body allergic reaction. I'm talking about allergies or a local reaction. How do you get a total body allergic reaction? It has to be what? Injected or ingested. And what I just explained to you happens now all over. So you're in the blood. You got your allergen in the blood. Okay? So, and you better write this down. On your first exposure, did you get a lot of plasma cells and a lot of formation of antibodies? So it is your second exposure. That's why people may not even know that they're allergic to something until they go into an anaphylactic reaction. Because on their first exposure, you may not get enough histamine released because you didn't have enough antibodies produced to get even any type of reaction at all. Do you understand that? So on your second exposure, this is what happens. So. Yeah, that's a B. And then boom. Now it injects bee venom. Uh-oh, it changed color. Did you see that? What the hell is that? And just so you know, when a bee bites you or stings you, it rips out its stinger. You ever see that? And it's got a little sac on the end, and then it contracts and puts that bee venom into you. The bee dies, though. I know, that's really sad. But he just stung you. You feel bad for him? Have a little funeral for him. Okay, so what do you got now circulating in your blood? And when you were a kid, 2 years old, never forget it. You're playing with that rattle, biting it, and you got stung by a bee. This is your second time you're getting stung by your bee. So what's floating around in your blood? What's floating around your blood? Plasma, B cells. And when they come in contact with that bee pollen again, what are they going to produce? I'm waiting. They're going to produce a gazillion antibodies. And those gazillion antibodies bind themselves to what? And where is the bee venom? All over the blood. Where do you have blood vessels? That's good. That's good. Write that down. So, mast cells contain histamine, and when the bee venom binds to the antibodies, it's going to cause the mast cells that are circulating everywhere to release what? And what do histamines do to arteries throughout your entire body? It will cause massive arterial vasodilation. Where? Everywhere. And according to old Flola, how could we forget? If the arteries dilate everywhere, what happens to resistance to arterial blood flow? So what happens to your systolic blood pressure? And if you don't maintain a mean arterial blood pressure of at least 60, you are in what caused the shock? A total body allergic reaction mediated by histamine, and that's called anaphylactic shock. Say yes. You ever see someone in anaphylactic shock?
No.
Anybody allergic to anything? What are you allergic to?
My sister did. We didn't know she was allergic to shrimp. So she ate the shrimp, and she could see her face just swelling up.
Yep.
I can't breathe. I can't breathe. She kept saying, I can't breathe. And so my sister gave her some Benadryl. But she was having a hard go of it.
Because, watch, Benadryl stabilizes mast cells so it doesn't release any more histamine. It don't do anything for the histamine that was already released, and the already released histamine causes massive arterial vasodilation. Where? Everywhere. And increased capillary permeability, ain't that right? That's why her face started swelling up, because all of the fluid came out of the bloodstream into the interstitial space. Do you have any idea how good that information is? Any? This is rock star information. You think I'm lying? This is exactly what you need to know. Correct me if I'm wrong. I know. Now watch. Watch. The lungs, the lining of the respiratory system, very vascular. Right? The airway is rigid. So when the blood vessels dilate in the respiratory system, they dilate inward. So it cuts off your airway. That's why people, I say, it felt like my throat was closing off. That's because it is closing off. Tell me you got that. And it will cause bronchospasm too, so they will start to wheeze. Say yeah. Guys, what's the treatment? Is that bad? Is that worse than a stuffy nose?
Yeah.
Good. So is epinephrine appropriate?
Yes.
Yes. And watch, you don't take their shirt, roll it up, take alcohol. I saw a nurse do that one time. She was drawing blood on me, right? She rubs it with alcohol and goes, I said, did you just blow on my arm? I go, why don't you just heck a loogie on it? You take that pen, you twist it, you go into a large muscle, use it a leg right through the clothes, push it in, hold it down for about 15 seconds, and get their fatty acid to the emergency room. Say yeah. Once in the emergency room, they may give you epinephrine. You can give epinephrine, one shot of it, every 10 to 15 minutes. And do you want to give them Benadryl?
No.
Why not? Do you? Do you want this to happen again? Right? Do you want the mast cells to continue to release histamine? No. So you will give them IV Benadryl, and what does the Benadryl do? It stabilizes the mast cells so they don't release the histamine anymore. And one of the things that they will be given is what's called a med dose pack. You ever hear of it? A med dose pack is prednisone. Prednisone is a corticosteroid, and what caused this? An exaggerated immune response. What do steroids do to your immune system? Suppress it so it doesn't exaggerate. And why do they step you down? Why do they step you down?
So your body still
So
needs.
your adrenal glands don't just shut off.
So that you give the adrenal cortex the time to come back to life like Don Gatto and start producing natural cortisol. That's why they step you down. Also, if you're having respiratory issues, anybody got asthma here? Do you have a little Albuterol Inhaler? That's a beta-2 agonist. It stimulates beta-2 receptors in the bronchioles of the smooth muscle and causes them to relax and cause bronchodilation. So you will give them, once you stabilize their cardiovascular system, you worry about their respiratory system, so you give them a nebulizer or a Ventolin to open up their airways so they can breathe good. Tell me you got that. That's why they carry EpiPens. Some insurances, I don't know, they're like, EpiPens are like $5,000 or something like that. Can you believe that? So you know what I do. I discard the, I know people in the area, and when they get rid of EpiPens that are outdated, I take them. And people that need them, I give them. No insurance. I buy brand new EpiPens. Right? That's ridiculous. If somebody needs that and they're going to die from that.
I remember you said what she said before, right? You can give coffee if someone's having
An asthma attack with anaphylaxis, that ain't gonna help
no,
much.
with like asthma.
But asthma, yeah. If you don't have an inhaler, you can give them coffee. Caffeine is metabolized to an intermediate called xanthine, and xanthine is a natural bronchodilator. So if you got a little kid with asthma, right, and you ran out of his inhaler, give him a little cup of coffee, and then see if that doesn't help. See, yeah. That's anaphylactic shock.
What was that steroid pack called?
It's called a med dose pack. It's a step down of steroids. They usually start like heavy doses of steroids, like 40 milligrams, maybe 4 times a day, and then they slowly step you down.
What did you say, a nebulizer or a ventilator?
No, a nebulizer with Ventolin. Ventolin's a beta-2 agonist. Agonist stimulates. So you're stimulating beta-2 receptors, and when you stimulate beta-2 receptors, it causes the bronchioles to dilate. Say yeah. What is Ventolin, which is like epinephrine, what does it do to blood vessels? Constricts them. So it dilates the bronchioles and constricts the mucosal lining of the respiratory system as well. Say, did that make sense? That's anaphylactic shock. You got me? All right. And remember, this sounds like a good question. On your first exposure to something, are you going to get an anaphylactic reaction? Now, one of the things you need to remember too, and I don't have time to go into it, it's called a delayed onset anaphylaxis. So these people can go into anaphylactic shock. You can give them epi, give them some Benadryl, and 6 to 10 hours later, maybe 12 hours later, it happens again. That's why they're given the steroids, to prevent that from coming out. It's called a delayed onset. Yep.
Like 3 hours later. Like what Seema got the number.
Yeah.
Yeah.
How long do we give steroids to children for? Because I got yelled at. I said that in the clinical once, and she's just like, we don't put children on steroids because it stunts their growth. That's what she told me. Straight up, I was just like, okay. So,
Like, what do you mean children? Like how old?
like 8, 10-year-old, 8 to 10, 12 maybe.
Yeah, it has some. It has some. If the asthma is bad, like really bad, they're on steroids.
What does
Right.
Openex do?
What?
What does Openex do?
I don't know.
It's for nebulizer for asthma.
I don't know. I'll have to look that up, and I'm not looking it up now. My neck hurts. Screw up my back. You know what I think it is? I think it's from, like, not reading the textbook. Where's my pen? How many people follow that? That's anaphylactic shock. You need to know the emergency management, and then, once you stabilize them, you should understand that you want to give them Benadryl and antihistamine, and then steroids, right? And it's usually a med dose pack. Does that make sense? Okay.
Do they get a med dose pack and an EpiPen?
I don't even know if they give them an EpiPen in the emergency room. I don't know that. Do they? I don't think they do.
I don't think so. My friend had to buy hers personally.
Yeah.
No, like they
And
don't
she
give them one
kept
to
it like
take
a
home.
treasure.
No.
What's that?
They don't give them one to take home.
No.
They would give them a prescription. So
Right.
they can go buy their own.
Yeah.
Crazy.
They're not going to give them one, and or charge them like $20 million. What you do is, if you're smart, is you make a distraction. You get into their crash cart and you get a vial of Epi.
I just read a post not that long ago on how to get like a cheaper brand of like $20. I think it was like you get your prescription, but then you have your doctor write I think it's like a knockoff version, like allowed, and so it was like $20.
Really?
Yeah, I saw it somewhere.
Yeah, from Joey Buttafuoco Pharmacy. Psst, psst, come here, got some EpiPens for you. Yeah.
If you know
Well-
I knew somebody laced some brownies with some male enhancement drugs or something.
Yeah, that happened. That happened at some high school.
Yeah.
Yeah. Yeah, they get the little young kids, if they need male enhancement drugs. Yeah, they get priapism, right? And it says, you know, if you have an erection that lasts longer than 4 hours, that's a medical emergency. To me, that's a good day. Okay. What?
Why do we try?
Look, you know what it's, that's what you got to put up with. But look at the quality of information that you're getting.
No.
They're not going to explain this to you. Right? You got that, right? That makes sense, right? It does. All right. Let me go over, I don't know, I like this. I like it, but I don't like it. Neurogenic shock. Okay? All right, write this down. Put it big on a piece of paper. Put a star next to it. Neurogenic shock and spinal shock are not the same thing. You know what these things are remind me of? Ron Popeil, Pocket Fisherman. Remember Ron Popeil, Pocket Fisherman? Alright, watch. Which is harder, your spinal cord or the vertebrae? That's very good. When you damage tissue, what do the blood vessels do? They dilate. So is the swelling of a spinal cord going to come out or go inward? It's going to go inward. So when you damage your spinal cord and the damaged area gets the release of those inflammatory markers, are you with me? As the more blood's going to that area, it's going to begin to compress the spinal cord. Say yes. And that area now is damaged. And wherever the area is that's damaged, the brain can no longer communicate with that part of the body. And you can't send any sensory information to the brain. Tell me you got that. Okay. Now this is where knowing a little anatomy and physiology is important. You ready? Neurogenic shock has to do with understanding the anatomy of the autonomic nervous system. And if you're ever going to get it, you need to get it right now. Right? Something's happening April 22nd. I know what that was. Well, I think that was the last day of class. I always write that down on the nervous system. Because when I talk about the nervous system, it makes me nervous. I know April 22nd is going to be over. I hate me too. Looking in the mirror the other day, I don't like looking in the mirror, you know, but my ears are getting bigger. So my girlfriend says I'm going to live a long time if you got big ears. Did you ever hear that? I'm looking around at you guys. Some of you, man, might not make it through the week. Hey, this one guy I went to junior high with, he had the smallest ears I've ever seen on a human being. These little tiny ears. Did you ever see that? All right, here we go. Better write this down. Watch. The sympathetic nervous system comes off the middle of the spinal cord. And you better write this down. When the sympathetic nervous system is stimulated, you have what's called the sympathetic ganglion. All you need to know is this. When the sympathetic nervous system is stimulated, all portions of the sympathetic nervous system are stimulated. You got me? Because they are connected in series. Are you following me? Now, you have the parasympathetic nervous system that is connected at the upper portion of the brain and the lower portion of the spinal cord. The lower portion of the brain and the lower portion of the spinal cord. You got me? So if you have damage to your spinal cord above T6, thoracic vertebrae number 6. The brain cannot communicate with the sympathetic nervous system. Are you with me? And as you recall, the sympathetic nervous system also stimulates the adrenal medulla to release what? Epinephrine. And what does epinephrine do to all of your blood vessels? It constricts them. Are you with me? So, for a spinal cord injury above T6, there is loss of background sympathetic stimulation. So, the sympathetic nervous system innervates arteries. What do they do to arteries under sympathetic stimulation? It causes them to constrict. So if you have a spinal cord injury above T6, then you will lose background sympathetic tone. And it will cause what? Massive arterial vasodilation. And according to Ohm's law, don't do that. Ohms gets upset. If all of the arteries dilate due to the loss of sympathetic tone, what happens to resistance to arterial blood flow? And what happens to systolic blood pressure? And if you don't have a mean arterial blood pressure below 60, you can't perfuse your brain and vital organ, so you have shock. And what caused it? Damage to the spinal cord above T6, and that's called neurogenic shock. Rock on. Whee! Watch it. Watch it. And I'm not being stupid, I'm being serious. Parasympathetic innervation causes a male erection. Do you understand that? So if you're yelling at your guy and you're upsetting him, that's going to stimulate the sympathetic nervous system. You should write that down. Are you writing that down? So be nice to him. Hi, honey. Here. Here's a beer. Watching TV. I'll take the garbage out. So watch. One of the signs of neurogenic shock is the guy will get an erection because they lose sympathetic tone and the arteries dilate. And for you to get an erection, well, not you, but people not like you. Guys, you have to dilate the penile artery. So you will get massive arterial vasodilation and the guy will have an erection. That is one of the criteria that someone can be going into neurogenic shock. Tell me you got that. Guys, what's the treatment for neurogenic shock? You give them drugs that mimic the sympathetic nervous system. So drugs like Levophed. Levophed is norepinephrine. Dopamine. Have you ever heard of a drug called dopamine? Dopamine is a sympathomimetic. It increases heart rate, force of contraction of the heart, it causes vasoconstriction. Levophed, and if that's not enough, then you give them epinephrine. Intravenous epinephrine to maintain a mean arterial blood pressure of at least 60. Now, watch. And they don't know why this is happening. They just know it's good. When somebody damages their spinal cord, initially, if they have a spinal cord injury where they're getting inflammation, they have spinal shock. Spinal shock means that everything below the site of the injury, all autonomic control, all nervous system function stops. They can't move, they crap themselves, they pee themselves. And they can't feel anything. That's why, like when football injuries, oh, I saw us moving his leg. They don't know why that's a good thing. They just know it's a good thing. So after an injury and the inflammation starts, you get what's called spinal shock. Spinal shock means everything below the site of the injury, all nervous innervation stops. Say yeah. So, spinal shock is instant, right? It happens. And that spinal shock can lead to neurogenic shock. Do you understand that? Spinal shock is loss of all sensory and motor below the site of injury. And spinal shock can cause neurogenic shock. Yep.
I saw a professional football game where this player got hurt in the back, and then they put ice, like super cold ice, is that to slow down all the...
Yes.
the white
That guy
ice?
actually walked again. What they did is they did what's called, they did intrathecal iced saline. So they actually gave it into the cerebrospinal fluid. They circulated that ice saline around the spinal cord, so it was like you twist your ankle and it's like putting an ice pack on it. And that guy actually walked out of the hospital. Can you believe that? If you guys, when you leave, if you want to, you can play with this. Anybody want to play with it? And watch, the most mobile part of your spinal cord is the cervical and first three thoracic vertebrae. That's why damage to this area produces profound effects in the spinal cord. And we know this, right? Below C5, they can breathe diaphragmatically. Above C5, they will need to be required to have ventilation, right? So below C7 and above T1, right? So in this area, they're going to be a quadriplegic. So anywhere below C1 and above T1, they're going to be a quad. And below C5 or above C5, they're going to require mechanical ventilation. So you can look at a quad and determine whether or not they're going to require mechanical ventilation or where they're injured. Did you follow that? A little bit? Yeah or no? All right. That's neurogenic shock. So watch. What's causing the problem is arteries dilating all over. Yeah? So what do you want to do? You want to constrict those arteries, and you know what constricts arteries. In neurogenic shock, it's not a volume problem. It's a arterial problem. So give them vasopressors or stuff that's going to constrict arteries. Are you with me? You want to take a little break just real quick? Do you like 5 minutes? Do you? Guys? I need a break. I gave tests today. You got anybody want to swig up my Diet Mountain Dew? No. What about you?
Telling me that when my sister had her little episode, she should have went to the hospital.
Absolutely. She didn't though, huh?
No, we just thought she was just allergic. She started developing these huge welts
Yep.
everywhere.
Yep. And she had a hard time breathing, right?
She said, I'm itching. She said, I can't breathe. She was panicking. We thought, oh, okay. We just thought she got sick from it.
Mm-hmm. She got all swelled it up too, huh?
Blew up.
Yeah. Yeah. Next time she needs an EpiPen. Or just make sure she don't eat shrimp.
Oh, you bet. After that,
Right?
she says the smell of it even just kinds of, wow. We looked at it, we're like, oh, maybe this is a lot worse. And my sister was like, oh, here, have some Benadryl. We think you're allergic to it.
I think allergies and food allergies are much more prevalent now than when I was a kid. I just believe that. Because all these kids, like, we never had that many problems when I was a kid.
And it's so funny you said that because she had, I don't understand. She said, I've eaten it before and I don't understand. And she's like, oh, I can't breathe. And she was like really panicking. She was like, I can't breathe.
Yep. When you can't breathe, you get anxious.
Mm-hmm.
You ever not be able to breathe, Kelly? Really? Well, all right, I'm going to stick a dirty sock down your throat and then see how it feels.
Can you be born with allergies too, or no?
No, you got to develop them. You can have a predisposition. Like if your parents have allergies, then if both of them have the same allergy, there's a 70% chance that you're going to have it.
So babies who become like lactose intolerant, like in their first like couple months, that just is because it happens.
It just happens there. It just happens. Like celiac that's a little bit different. That's actually like you get an inflammatory. It's an inflammatory response, but it's an allergy. Like it's a gluten. It's a little more serious than like being lactose intolerant. Do you guys want to fight? I don't want to fight. I used to get in fights all the time.
Is it really inconvenient if I take the quiz late again?
This is starting to be a pattern,
I know.
but it was scheduled tonight, so yeah.
Because I was gonna not come next.
You get a lot on nerve. Why don't I not come next week? Can I not come next week? Huh? Can I? You learning something in this class, aren't you?
Well, I'm still gonna watch the video.
Are you learning anything?
Yeah.
No, you're not.
I did not know all that about shock.
You did? You gotta watch the stages of shock.
I watched.
That makes sense, right? That's why family, they will come to you and say, well, they're smiling and they're moving. Nobody's home. Who's got pizza? Where'd you get pizza? Huh? Who's your friend?
What is that intrathecal? Like, what exactly is that?
It's into the spinal cord directly. Like it's into the cerebral spinal fluid where you're injecting medication into the cerebral spinal fluid.
See my text on yours.
Did you give me anything to eat?
Did you ask for anything?
Watch. You're supposed to anticipate my needs.
I thought
You're right. I should have been like, would you like anything?
Yeah. Yeah.
Normally I
You used to be.
would.
I know.
I don't know what happened. I
You
used
should
to be
read
so
the
nice.
emails she sends me. She is so nice.
I sent an email.
Like your emails are really nice. Like like when I get one from you, I'm like, this is just gonna be so nice. She's so nice. It's like, wow, that just makes me feel nice.
I sent an email to my boss from the Olive Garden to tell him I was quitting. I was like trying to tell him that I wanted this day to be my last day, and it was like a long, and he was like, thank you for the eloquent message, but your request has been denied. Because he doesn't want me to leave. Like, he's
Oh.
just joking. And he said LOL, but
Yeah, they're always very nice. They always have a nice little salutation, then you get to the point, and then there's a nice, little.
it was funny because one of the nursing people sent out an email to everyone talking about how we should be emailing our instructors. And I was thinking, I always email my instructors like that. Like I guess some people are emailing their instructors like very short and just not properly, I guess.
That's what I do to my dean all the time. Hey, I got my evaluation today. It's like there's professional courtesy. Like when I get evaluated, when I have to go to her office, I wear a suit and tie. Because I was taught when you get formally evaluated, you dress formally. That's the only time when I went to court. I'll tell you, man, people tame in front of a judge. They do. Most people. Now I thought that judges, they could tell if you were lying. Like they had this special skill. I'm not kidding. Like when I went to court, my lawyer yelled at me. He goes, you want to lose this case? I go, I'm telling the truth. He goes, yeah, you're going to lose. And I didn't tell him this, but I thought, well, the judge knows if I'm lying. Why are you looking at me like that? Look at my poor glasses, too. Hey, you know what I found out? I can retire now. I talked to my lady. Not my girlfriend, but the lady who handles my retirement. She goes, you can retire now if you want to.
Are you gonna?
Yeah, I'm retiring right now at 7:10.
Like within the next 5 years?
Yeah, I gotta keep my kid in my insurance because I think he's gonna be one of those failure to launch. I'm cutting grass like I always do, and like how you have these thoughts that enter your mind.
Yeah.
Like he went to this Comic-Con thing down in Chicago.
Comic-Con.
Yeah, I don't know.
Oh.
So anyways, I'm thinking, what if he met a girl down there and got her pregnant, and then, because he's a romantic, well, Dad, we're gonna have to get married, and I'm like, oh God. With a girl, I can't imagine if I would have had a girl.
If you had a
Stay locked in your room until you're 60. That's why guys are so protective of their daughters. Because they know what guys are like.
I think you're forgetting she'd be your daughter. Your daughter.
Yeah.
The sass level would be like through the roof. Like, sass for days.
Yeah, I know. My kid's like that too.
How old is he?
21. So I went golfing with my buddies, right? And my kid goes, oh. And I go, yeah, my kid, he's freaking lazy. And he goes, oh, Dad, I got something for you. I go, what? And he goes, he won't clean the hair out of the tub. So you know what I did this morning? I took it out. I was dressed in a towel. I go out to his truck and I put it right on his driver's seat. That'll learn him, right? Then he don't rinse the toothpaste out of the sink. I go, how long would that take? How long would that take?
I think that's your fault though.
Why?
Because you spoiled the living shit out of it.
I know.
So it's your fault. Stop complaining.
I know, you're right. You're absolutely right. But I can rectify that. I'll just kill him.
Sometimes when you have kids and you try to teach them to do stuff, it's a lot easier to just do it yourself because they do it the wrong way anyway.
No,
Husbands
see,
work the
see,
same way.
right. See, that's what I did. I said, go out and cut the grass. And I said, I want to tell you, I cut the grass to make it look nice. You cut it to get it done. And I want you to know that if it doesn't meet my specifications, you're going to do it again. And sit down, I'm going to explain something to you. That's not your truck. It's my truck, and I give you the privilege of driving it. Do you understand? When your name's on the title, then it's your truck. I told him, that's not your room either. That's a room that you stay in. And I can go in and out of it anytime I want and go through your stuff. So if you don't want me to find it, you better hide it really good. Then I tried the psychology on him. I said, sit down. I'm going to ask you one question, and I want you to answer it honestly, as you see it. Not what you think I want to hear, but as you truly see it. And he goes, okay. I go, are you ready? He goes, yeah. I said, do you think I love you? He goes, Dad, I know you love me. I go, you're right, I do. So, do you ever think I would think in my head, I'm going to make this kid do this, and it's really going to fuck him up. It's really going to be bad for you. Do you ever think I think that? Well, no, Dad. I go, why wouldn't I do that? Well, because you love me. I said, you're right. So, when I tell you to do something, all you got to do is think, my dad loves me, and I don't know why he wants me to do it, but it must be good for me.
What did you say?
You know what? I think, like, guys just don't grow up very fast. They just don't. Like, guys don't, like, I didn't get it together until I was about 30. You know what I mean? But what you have is a guy when he's 25, or, you know, give him 30 now, is what you're going to have the rest of your life. If that guy ain't motivated by the time he's 30, he ain't never going to get motivated. Because he's found a way to get what he wants without being motivated. That's my human turd. By the way, you got another DUI over the holiday.
How does he still have his license?
He doesn't. But he has a motorcycle, a car, a van, and a truck. And all this music equipment. Like giant speakers, lights. And he had pancreatitis a while back. He was in the hospital. Calling me. My light pace is 1100. I go, yeah. I go, don't eat. I'm hungry. I didn't eat. But Saturday night at 6 o'clock, God came down and suddenly healed him. And he was able to rise out of that hospital bed, get dressed, drive to his mom's house, pack up all his music equipment, and go play it at a bar.
Praise Jesus.
I said, why don't you, I used to have a houseboat, not a houseboat, a pontoon boat. Loved that thing.
Why'd you get rid of it?
I had a place up north and I sold it. I don't know why I did that either. It was nice. He put a stereo in it. It was nice. Listen to some tunes, like Sugar Sugar by the Archies. Aw, honey, honey. And then we'd bust out Slow Motion by Juvenile. I like it like that.
Is that your favorite song?
See, that's juxtaposition. an old white guy singing Juvenile. Ilda, I hate me too. Okay. Anaphylactic, neurogenic. Say yeah. Don't hate. Appreciate. I'm going to go over septic shock. Listen up, because this is true. 3 groups of people get septic shock. What are those 3 groups of people?
People in hospitals.
People in hospitals. You know who's in the hospital, Emily? Sick people. The very young, the very old, or the very sick. Watch. How many people have had the geriatric nursing? You taken that class yet? No. The most common cause of sepsis in the elderly is an untreated UTI or pneumonia. Okay? And it's usually, how many people have had microbiology? Gram-negative bacteria. Kelly, do you have microbiology? Gram-negative bacteria release a compound. Watch it. Called endotoxin. You got me? Now, what is sepsis? If you're septic, what you got? You have bacteria in the blood. Where does the blood circulate? So where do you have that infection? Everywhere. And if you have a gram-negative bacterial infection, what does that bacteria release? Endotoxin. Better write this down. Better not pout. Endotoxin, along with other chemical mediators. Oh. My pen's dying. Is a massive arterial vasodilator. You got me? Where's the endotoxin in the bacteria? So what's going to happen to all of the arteries of your body? And if they dilate, Q equals systolic blood pressure over resistance. What's going to happen to resistance to blood flow? What's going to happen to your systolic blood pressure? And if you don't maintain a mean arterial blood pressure of at least 60, you are in what caused the shock? Bacteria in the blood. And when you have bacteria in the blood, it's called sepsis. So you are now in, for the crowd, say yes. That's it?
Antibiotics.
No. It ain't that simple, sister.
That's why I said that.
Okay. So, just so you know, I did my due diligence, and I found this to be the best little flow chart to explain septic shock. All right. Now, watch. Remember how I told you these white blood cells get into the interstitial space and attack the bacteria and release these chemicals? Well, where's the infection? So these chemicals get released into the blood. And you better get this. So when you get an infection, when you get sepsis, you're going to have white blood cells. These white blood cells are called monocytes. And when monocytes encounter a pathogen, they get turned on. And they become macrophage. Macrophage are activated monocytes. They're turned on. Tell me you got that. Hang on, I gotta get my glasses on. Watch. And they release all of these chemicals. Tumor necrosing factor. And what that does, that tumor necrosing factor, the TNF, that damages, that says damages, the inner lining of blood vessels. Are you with me? And when you damage the inner lining of a blood vessel, and this is going to happen all over, you are going to activate the clotting mechanism. These people will begin to develop clots, little small clots in the arterioles and in the capillaries, all over. And they get a condition called DIC, Disseminated Intravascular Coagulation. Have you ever heard of it? And it happens all over. So you will start producing clots in small arteries and arterioles that supply every major organ of your body. And if you can't get blood that contains oxygen to those organs, you go into multiple organ dysfunction. You get what's called MODS. Have you ever heard of it? MODS? Now watch. If your liver begins to fail because you've got DIC in your liver makes blood clotting factors. So the DIC will cause later, as the shock progresses, for these people to bleed out and hemorrhage. They will begin to bleed and you can't stop it because they used up all the clotting factors in the initial shock, and now the liver's failing and it don't produce any more clotting factors, so now they will begin to bleed to death. Tell me you got that.
I don't get it. Like, you have clots all over and then you bleed out.
Right, because you used up all your clotting factors.
What's like the timeline on that?
Depends.
Quickly.
It
There's a
really.
lady, she had a C-section and she had nothing wrong and it just happened.
You're talking about hours. Hours. Tell me you got that. Guys? So the important thing to remember is it's prevention. And the bottom line is this. People who have sepsis, and then it starts progressing into septic shock, they typically don't survive. The mortality rate is very, very, very high. And it's usually due to end organ failure. Right? Your liver and your kidneys are shot, and then it's over for you. Once your liver goes, it's over.
That lady, though, she had nothing wrong with her. Like, she had a normal pregnancy, she was healthy, and she did end up having an emergency C-section, and she went into DIC, and she ended up losing her blood all over the place. And
Yeah, they said something to look out for is like losing blood from an IV. Like,
What's that?
they said look out for like losing blood from an IV because at that point that's when this is happening.
Yes.
And they'll start bleeding out through their IV.
Yep. Yep. And I saw people that start bleeding through their eye socket. Blood will start coming out of their eyes. Start coughing up blood. Right? It's nasty. Let me just say this too. One of the things that happens is when endotoxin gets into the blood, it has a profound effect on the brain. Endotoxin can cross the blood-brain barrier. That's why in the elderly, if they start acting goofy and they don't have any other signs, you always think UTI. And the reason you do is the effects of endotoxin being released on the brain. So that's what causes the goofiness and UTI. Isn't that cool? Okay. Now, watch. Watch. If you can't get oxygen because of these small blood clots all over the place, what's going to happen to metabolism in the tissues? Will you be able to make ATP aerobically? So those cells will switch to anaerobic metabolism, and what's the byproduct? Lactic acid. That's why in people with septic shock, the power point goes off. And when the power point stops, they die. So somebody just died from septic shock.
And drugs all the time.
Lactate levels? Yep. So they've simplified the criteria for septic shock. You should write this down. Normal lactate levels, we produce lactate. Matter of fact, the heart be loving on lactate. The heart loves lactate as a choice of fuel. If it had a choice between Burger King, McDonald's, and lactate, it's taking lactate. So a normal level of lactate is 2 millimoles per liter. So the criteria for septic shock, in the absence of any other clinical information, is a blood pressure, systolic blood pressure of less than 90 millimeters of mercury, and a lactate level greater than 2 millimoles per liter. If it's greater than 2 millimoles per liter, and your systolic blood pressure is less than 90 millimeters of mercury, you treat that person for septic shock. You got me? Now, in septic shock, you're going to get a release of all these chemical mediators that are going to damage blood vessels. So what's going to happen to blood volume as a result of these chemical mediators and the blood vessels kind of falling apart a little bit? You're leaking fluid out of the vascular compartment. So what's going to happen to your blood volume? So one of the things that you will do is in septic shock is you resuscitate them with IV fluid. So you start big old IVs and you start giving them fluid, trying to keep their blood pressure greater than 90. If that don't work, what caused the shock ultimately? What ultimately causes the shock? arterial vasodilation. So you want to give them some vasopressors. So you're going to give them dopamine, right? Or Levophed to constrict the arteries to keep their blood pressure up. And then watch. Initially what you want to do is they have sepsis. So you got to get rid of the bacteria. So you will give them a broad spectrum antibiotic. Immediately. They come into the ER within the first hour, they should be getting IV antibiotics, regardless of whether you draw blood cultures to find out what the causative organism is. It don't make no never mind. You give them a broad spectrum antibiotic. Say yeah. Then you're going to draw lactate levels. Then you're going to see if their kidney and liver function are normal. So you're going to draw liver enzymes and kidney function tests. Say yeah. And then you do blood cultures. And you usually draw them. Do you do them on 2 different arms? And you do them, 15 minutes apart, right?
Either do them both on the same arm, like different arms right away, or an hour apart on the same arm.
Okay. And the reason they do that is they want to make sure, because do you use betadine? What do you use?
It's like a special, it's not the normal alcohol wipe, it's like a different swab.
Because what you want to do is you want to kill the normal bacteria on the skin. So when you stick the needle into the vein, you may contaminate that culture by the bacteria that's on your skin. And the reason you do it in 2 spots is you want to make sure that the bacteria that you're culturing is actually in the blood and it's all over. That's why you typically do that. And then they'll culture it and they'll give you a preliminary result, and they can do that in a couple hours, right? And the final result usually takes about 72 hours. The point is that you start giving them broad spectrum antibiotics and you fluid resuscitate them. So you start big old IVs and you give them fluid and you find out what's causing it. Say yeah. And then the rest is basically you pray. If they've gotten to the point where they have signs of DIC, it's usually not very good. They don't make it. They don't. Say yeah. Can I show you one more thing and then you can ambulate? Yeah? Watch. Nursing schools love this. I don't know why they love it. I don't love it. What the hell is it? Have you ever heard of Autonomic Dysreflexia? Do you want to know about it or no? Do you? It has to do with neurogenic shock.
I think I heard about it. Something about the signal
Yeah.
bouncing back.
Yeah, where is it? Okay, hang on.
They make you learn so much useless stuff in your brain, kind of.
This is actually, like, if you work on a neuro unit, this is important. Hang on.
This has to do with like the myasthenia gravis, the autonomic dysreflexia.
People with
They give
spinal
you-
injuries,
Yeah.
They give you that.
their blood pressure goes crazy on it.
Yeah, watch. When you get hurt, like, let's say that you got a bed sore, or you got a bunch of poop in your butt and you haven't turned it in a while, right? Or you got a kink in your catheter and you're a quadriplegic. You got me? Remember, to be a quad, you have to have a high spinal cord injury. Are you with me? So any time that you damage tissue, it will stimulate the sympathetic nervous system. Are you following me? So typically, and the injury has to occur, or the noxious stimuli has to occur below the site of the injury. So I'm saying the spinal cord injury is here. You got me? what that's going to do is that's going to stimulate the sympathetic nervous system. The sympathetic nervous system below the site of the injury is intact. So what it's going to do is it is going to stimulate the sympathetic nervous system. And what does it do, the sympathetic nervous system, do to all blood vessels below the site of the injury? It's going to constrict them. So if all of your blood vessels constrict below the site of the injury, and that's a large amount because it includes the arteries that supply the gut and the spleen, and the spleen is a reservoir for blood and it's very vascular, that's going to cause resistance to blood flow to go up. Tell me you got that. And when your blood pressure goes up, there are baroreceptors in the arch of the aorta, and they're going to sense that increase in blood pressure. And because the sympathetic nervous system can't be stimulated, you will get reflex parasympathetic stimulation of the heart. And it will cause your heart rate to drop. And it's actually kind of weird to actually see it. Above the site of the injury, because you get parasympathetic stimulation, their skin will get red, flushed, and they will begin to sweat, and it is perfectly demarcated. And below the site of the injury, the skin will be pale and cold due to the vasoconstricting effect. Did you follow that? And the blood pressure can go up so high that they will start complaining of a headache due to the arterial vasodilation within the skull. They'll complain of a pounding headache. And if the blood pressure gets bad enough, they can actually stroke out. And with the high blood pressure below that, it can cause damage to the organs as well. That's autonomic dysreflexia. So the first thing you do in someone who has autonomic dysreflexia, if they're laying down, is you sit them up. Why would you sit them up?
To get that blood flow to the
That's right. See, you decrease venous return. That will decrease the stretch of the heart, and of course, and the blood pressure will drop. And then you look for what's causing it. Is it a kink in the catheter? Do they have an ingrown toenail that's causing pain? Do you understand this? So you look for the cause. The most common cause of autonomic dysreflexia, two common causes: urinary retention and fecal impaction. So dig the poop out, unkink the catheter. And if that doesn't work and the blood pressure keeps climbing where they could potentially stroke out, then you give them, and almost all people who are quadriplegic, who have a history of that autonomic dysreflexia, they have Procardia tablets, and you tell them to chew it. Procardia is a calcium channel blocker, and it will override and will prevent the calcium from getting into the smooth muscle wall, and it will cause the arteries to dilate, lowering their blood pressure. Did that make any sense at all? That's autonomic dysreflexia. They're gonna hit you hard with this. They love talking about this stuff. And now you know how it works, don't you? Right?
No one explained it to me. It was in one of my books. They said it might be on our exams to study it. I couldn't find it anywhere. Like, I couldn't find it anywhere. Except for a little.
Did that make sense? It made perfect sense. And it's usually found again in high spinal cord injuries, typically above T6. And that has to do with the inability of the sympathetic nervous system to signal the brain. Because the brain helps control the sympathetic nervous system and the parasympathetic nervous system. But now all you got is the parasympathetic nervous system because you can't control the sympathetic because the brain can't communicate with it. So if their blood pressure, and watch, people who are quadriplegic, because they're not contracting muscles and their muscles are flaccid, they're not going to get the contraction of the muscle squishing on the artery, and they're not moving a lot. You should write that down. their blood pressure tends to be low, meaning their baseline blood pressure tends to be very low. So if their blood pressure is 90 over 60 and then it goes up to 120 over 80, you need to let the doctor know. Anytime there's an increase of 30 millimeters of mercury more in their normal blood pressure, you always think autonomic dysreflexia. Say yeah. And as you start turning flushed, then just update your Facebook status with flushed quad. And it's really weird if you ever see it. It's like, it's just weird. And I'm like, I don't know what's going on. Then the aide sits the guy up and go, what are you doing that for? That's how stupid I was. Do you want to be like me? I don't think so. Killing people. How many people I killed? Oh, maybe 3. You want to kill people? Do you? You want to save them? Write that down. That makes sense? Alright. Oh, what? I'll make a little video on the hypovolemic shock. What? In hemorrhagic shock, your first priority is what? Stop the bleeding. Don't worry about getting an IV in. Do you understand? Stop the frickin' bleeding. And you use pressure points. You know where the pressure points are, right? Huh? Right. So if somebody's bleeding on their face, then put a tourniquet around their neck. So if they're bleeding in the arm, you don't try to block all the arteries. Axillary artery. Boom. Tell me you got that. Leg, femoral artery. Tell me you got that. Alright? And watch. Hang on. I never showed you this, did I? Did I? Hang on. One more thing and then you can ambulate. And don't hate. Ambulate. What? Oh, son of a... Okay, wait. Okay, it doesn't go all the way down, but I'll make it go all the way down. If you can feel somebody's pedal pulse, you know they have a systolic blood pressure of at least 90. If you can't feel the pedal pulse, but you can feel the pulse in the femoral artery, they have a blood pressure of at least 80. So yeah. If you can feel it in the axillary artery, they have a blood pressure of at least 70. And if you can only feel it in the carotid artery, they have a blood pressure of 60. That's how a doctor can determine, or a nurse can determine, if somebody's in shock by feeling a pulse. Say yeah.
I can't say that I've ever tried to feel somebody's femoral artery. I don't know, I don't even know,
Yeah, that's not the first place you want to go.
I know, but I'm saying, they don't even really, I've never even tried.
You know, can I tell you, that wouldn't be a bad pickup line. Hey, can I feel your femoral artery? Let's see if you're in shock. That's on tape. This is going to have to be edited. Tell me you followed that a little bit. So know this, if you can feel somebody's pedal pulse, they're not in shock yet. They may be going into shock, but they're not in shock yet. Say, yeah. All right, that's enough for tonight. We did good. I'll put together a video on hypovolemic hemorrhagic shock, and I'll have it up this weekend. Okay? So Tuesday, review those questions. I'm telling you right now, you're going to get a lot of, you're going to get some questions on the stages of shock.